As we age, gravity and our body weight affect our skeletal structure by compressing the padding or disc between our vertebrae. The result is quite painful and sometimes debilitating, often requiring surgery to fuse the spine together. The goal is to accomplish the treatment in the least invasive manner possible. OZOP Surgical is developing a significant advancement in spine fusion surgery called balloon lumbar interbody fusion, or BLIF. After undergoing anesthesia, the patient is placed in a lateral position on a fluoroscopic table. The correct interbody level is identified with intraoperative fluoroscopy. A small incision is made over the target level. This incision is a centimeter or less in total length. A guide wire or probe is inserted through the annulus of the target disc. A dilator is slid over the guide wire to enlarge the annular opening. A working channel is slid over the dilator and anchored to the vertebra with a threaded K-wire. This anchor wire permits change in the angle of the working channel to facilitate disc removal and to prevent dislodgement of the working sheath, allowing the surgeon to use both hands. The initial guide wire and internal dilator are then removed. An endoscope is slid into the working channel to allow internal visualization of the disc throughout the preparation portion of the procedure. Initial nucleus material is removed with a standard pituitary rongeur. This can be visualized with the endoscope. A disc shaver is then inserted to enlarge the nucleus cavity and remove additional disc material. After the nucleus is removed, the end plates are cleaned to remove cartilaginous material. A trial balloon endoprosthesis is inserted into the newly formed cavity within the disc, and the balloon is inflated with contrast material which is visible on X-ray. The balloon is inflated until the entire cavity is filled and disc space height is restored. The volume of contrast material and the pressure are recorded. The trial endoprosthesis is then deflated and removed. A permanent endoprosthesis balloon is then inserted and filled with a polymer material that gradually hardens, with the volume of this material matching the amount measured with the trial balloon. Pressure is maintained until the polymer hardens and the delivery tube is detached from the BLIF implant. Once the balloon endoprosthesis is stable, it is filled with bone graft material to fill the inner cavities completely. The endoscope, working sheath, and sheath anchor are removed, and the incision is closed. The BLIF implant conforms to the inner shape of the disc and to its end plates, affording maximal coverage and a large potential fusion area. This innovative minimally invasive surgery offers the potential to complete the implant procedure in just a fraction of the time versus an open procedure, while also reducing blood loss, anesthesia time, and post-op recovery.